We get asked all the time if compression socks can heal neuropathy, and the truth is, okay, let's talk socks. I'm talking about compression socks. Lately, there's been buzz online that those tight, stretchy leg huggers can heal peripheral neuropathy. Some folks swear by them, while others are skeptical. So what's the real deal? Are these simple socks just for swelling and circulation, or could they actually be doing something more for nerve pain and healing? Today, we'll dive deep into what compression socks really are, how they work, and what role they play in the healing journey. Coming up. Hey there, health warriors. Let's talk about something quietly gaining traction on the internet, compression socks. They're not sexy. No, they're not flashy. They don't beep, and they don't come with a prescription. But lately, there's been a buzz. Could these tight socks be doing more than just easing swelling? Are they quietly supporting nerve healing? Some say yes, while others roll their eyes. So let's peel this one layer at a time to get to the truth. First, let's reveal exactly what compression socks are. They're tighter than normal socks, they're snug, supportive, and engineered with a purpose. They gently squeeze your legs, starting tighter at the ankle and easing up as they go higher. These socks aren't made for fashion. They're made to help move fluid, blood, and lymph, and they're used post-surgery, on planes, by athletes, nurses, chefs, and folks who stand for 12 hours straight. And they're great for anyone prone to foot, ankle, or leg swelling. Some people like the way they feel, while others find them downright uncomfortable. But regardless, they do work to change the physics of your circulation. As they apply this gradient pressure, starting off tighter in the foot and then lessening in the calves, they help push blood back toward the heart. This prevents fluid from pooling in the feet and ankles. It also encourages lymphatic drainage, and it reduces inflammation. Now, if you've watched any of our videos, you've heard us say that healthy circulation is critical to nerve healing because it helps deliver critical nutrients to the nerves for proper function and even healing. So here's the question. Is it safe to connect the dots and say that because compression socks improve circulation, they heal nerves? Well, not entirely. Let's look at the reason. It's true that compression socks will help minimize leg swelling and improve circulation, but there's a difference between relief and regeneration. Feeling better isn't always the same as healing. So let's look at the science. Always remember that nerve healing isn't a quick fix. Peripheral nerves, the ones in your hands and arms, feet and legs, they heal slowly. They regenerate at about 1 millimeter per day, or roughly 1 inch per month. That's slower than your nails grow. In order to regenerate nerves, they need fuel and power, which comes from your mitochondria, along with anti-inflammatory support and plenty of oxygen. Your nerves also require critical nutrients like methylcobalamin, benfotiamine, R-alpha-lipoic acid, and many others. In fact, we did an entire video series on the 7 critical nutrients necessary for nerve repair and regeneration. Don't worry if you've missed those, I'll leave links down below for you. An equally important ingredient required for your nerves to heal, along with all of these others, is time and patience. Nerve healing incorporates myelin sheath repair, the protective layer on the outside of your nerves that also help with signal speed. Nerve axons need to be rebuilt. This is like an electrical cord relaying messages or signals from your brain to your muscles and skin. If the axon is frayed, messages don't get through, and it can take many months, sometimes up to 2 years, for all this repair to happen. So back to the question, can a sock do all this? Can it do nerve healing? And the answer is no. These socks aren't rebuilding axons. They're not remyelinating nerves. They don't regenerate, they simply support. But before we toss them aside like yesterday's tube socks, let's give compression socks their credit. Although they can't directly heal nerves, they can absolutely support the healing environment, and that makes a big difference. By reducing swelling, improving blood flow, and easing pressure in the lower limbs, they help create the conditions where healing becomes possible. Now, get ready for an important side note, health warriors. Healing nerves, especially damaged axons, isn't about finding one silver bullet. It's about building a whole healing ecosystem. Compression socks are like one branch of a tree. They can support the surface, but healing, well, that happens from the inside out. If you want nerves to truly regenerate, it's like getting a tree to grow. You have to nourish the soil, feed the roots, and shine light. So let's look at where the real magic happens. Critical nutrients that restore cellular function, antioxidants that shield and repair nerves, and in deeper cases, photobiomodulation, a therapeutic light that awakens the powerhouses inside your cells and tells your body it's time to heal. These are the pillars of true nerve healing. They don't just mask the symptoms, they rebuild the foundation. If you want to learn more about photobiomodulation, what's the best wavelength, and how much power do you need, I'll leave links for you on some of the videos we've done on those. So you might be wondering, when should I actually use compression socks? Well, if your legs feel heavy or tired, if you stand or sit for long hours, if your feet and ankles swell by the end of the day, if you have circulatory issues like varicose veins, if you've had recent surgery, if your legs swell when you travel, either flying or riding in a car for long distances, or if your neuropathy symptoms get worse with swelling or inflammation in your lower legs, this is when compression socks can be beneficial. But, and this is important, health warriors, they're not for everyone. If you have severe peripheral arterial disease, if you've lost protective sensation in your feet and can't feel pressure well, or if compression causes you pain or unusual discomfort, then you shouldn't use compression socks, especially not without discussing it with your doctor. Health warriors, here's the key. If your nerves are struggling from deep within, from nutrient deficiencies, mitochondrial dysfunction, or chronic inflammation, compression socks can only do so much. They can support the outside, but always remember healing starts from the inside. So no, compression socks don't heal peripheral nerves on their own. But paired with the right nutrients, the right lifestyle, and the right therapies, they can play a valuable role in your healing journey. Health warriors, healing is rarely about one thing. It's about everything working together. If this video helped bust a myth or sparked a light bulb, hit that like button and subscribe to the Nerve Doctors and share this with someone whose sock drawer might need a reality check. Don't forget to click on that bell to stay up to date with empowering information to help you take back control of your nerve health. And remember, healing is possible, and you've got more power than you think. I look forward to seeing you on the road to great nerve health. Blessings. Today we'll dive deep. Okay, ready, take two.